A patient today asked about Latuda or Lurasidone, a second-generation neuroleptic medication used to treat schizophrenia, but also used quite a bit in bipolar depression. Second-generation neuroleptics affect dopamine 2 receptors by blocking them, and in patients with schizophrenia, this will reduce positive symptoms of schizophrenia like hallucinations and delusions. Doses for schizophrenia tend to be 40 to really up to about 160 milligrams per day with Latuda. And I do want to mention, or remember to mention, that when you take Latuda, you have to take it with about 350 calories or more of food when you take your pill. Otherwise, you won't absorb it correctly. So that is a very important part of taking Latuda correctly. But anyway, for schizophrenia, 40 to 160 milligrams a day or so with that medication. For bipolar depression, doses tend to be lower, more like 20 to 120 milligrams, typically taken at night with food. And rarely do doses above 80 milligrams give an individual an additional improvement in their symptoms for bipolar depression when Latuda is used by itself. And so usually for bipolar depression, doses that I tend to use will be 20, and then moving relatively quickly to 40 if there's no improvement there. But 40, 60, or 80 milligrams tend to be pretty common doses of Latuda for patients with bipolar depression. And I do believe that this is likely one of the most effective bipolar depression medications out there, particularly within the second generation neuroleptic category of medications. But it is a little bit tricky with having to take it with food, because if patients don't do that, then they're not going to get the effect that they normally would. With this class of medications, there certainly are potential side effects. When someone's on a second generation neuroleptic, it's important that they get their labs taken, typically a baseline before starting the medication or very early after they start the medication, and then labs usually 3 months, and then over time maybe moving to about every 6 months. Labs that someone's going to want to check are an individual's glucose and their A1C. A A1C is a measure of someone's glucose over the last approximately 3 months. You want to make sure that someone doesn't have a high risk for diabetes, or that the glucose isn't increasing with the medication, causing them to be at a higher risk for diabetes. You want to check blood cell counts, because individuals on this medication or on any SGA could have drops in their white blood cell counts, causing neutropenia or even agranulocytosis, which could be very dangerous. It is rare, but it could be very dangerous. And you also want to check someone's lipid panel, and specifically looking at triglycerides, so the amount of fat cells in the blood, and then their basic cholesterol panel, some of those numbers as well, because it can be affected by the medication. Weight gain is possible with this medication. Certainly some of the other SGAs have a higher risk for weight gain than Latuda or Lurasidone, but still, you want to monitor someone's weight. Now, I don't consider this a reason to not trial the medication, because if you see weight gain, then you can always stop the medication or change it. And if this is a medication that's really going to help someone come out of a bipolar depression, it may be worth at least seeing if it does improve your depression. And if there is any weight gain, you could always try to mitigate that in other ways, or switch medications if you have to. Sedation or tiredness is a common side effect of this medication, but because you typically start off at a very low dose to take it at night, often you can build up to the dose that'll work for you, and that tiredness during the day or grogginess first thing in the morning can wear off. And so just like any medication that can improve someone's mood, if someone does have suicidal thoughts, whether they're on a medication or not on a medication, or under the care of a provider or not, they always want to make sure they seek immediate medical attention. Call 911 and go to the emergency room, go to a crisis center, because that is not something that you can take lightly. If you have those kinds of thoughts, you need to stay safe. And often depression clouds someone's view and gives them a misconception about the world that they're never going to feel better, when really it's just suicidal thinking is a symptom of depression, and depression is a very treatable medical illness. If you believe this video pertains to you in any way, please be sure to reach out to a mental health professional directly. There are a lot of other side effects of this class of medications and the other medications we discuss in these videos, and you want to talk about all the risks and benefits of these medications with a medical professional.